My name is Ellie and I will be doing a walkthrough of the London Care Record with you today. This video is for GPs in South East London. This is only for South East London because if you are in different parts of London, you may have a different configuration of the London Care Record. So some of the names of the widgets and other bits of data may not apply to you. So let's start. If you are one of our GPs in South East London, you'll be accessing this through your clinical system. So there is no separate login for this. You'll be going through the patient record, through your clinical system, for example, through EMIS or Vision, and straight through into London Care Record, this view that you see here. When you do go through to this, please make sure on this top bar, there's a section that says loading partners. Make sure this says 100% before you start looking through the record. It just means that some of the data partners may be taking their time to be able to pull through the data. Depending on what's going on locally with those partners, that may take a few moments to load. So just make sure that's completely loaded before you start. If you're not sure and you want to double check which partners have loaded or not loaded. So at the moment I've got this switched on. So if you haven't, you can switch it on yourself. So if you go to menu and then show partner status, underneath the demographics bar, it will show you which partners have loaded and if they've loaded okay. If they haven't loaded or they're not showing, or it says something like NF or ND, it may be that the data is not available. Now, there are different reasons for that. One of those reasons may be that the patient has expressed their right to object. And that means that they have objected to having their information shared in this way. And there is a separate video that's on our YouTube channel for GPs to help navigate this information and patient information also that's available on their right to object. If you go to the link in our YouTube channel at the top banner, it'll go through to the Lewisham and Greenwich Trust page, which who are the managers for the data portal, and they have information and forms on there for patients wishing to express their right to object. So if you're a GP and you've got a patient who wishes to express that, then you can use that page to be able to navigate that pathway and to download the forms and anything else that might help. Another thing that's useful, just looking at the page view here, is in this top demographics bar, you have a small icon of a megaphone that lets you see alerts. So this is really useful for looking at information, for example, on London Care Record downtime. Obviously, this is a test patient, so the feed here is just headings, so it's just filled with blanks. But on the actual real London Care Record, you'll see some alerts around if there's any planned downtime, any issues with the information in the London Care Record, or any other useful information that you need to know as a user. So as you can see at the top, underneath the demographics bar, you have some options for filters. You can search for a date range. There's an option to look for local or external records or by a particular partner. You can also reconfigure how you look at the screen. So we can go from 3 columns to 1 column. You can also look at the data sources. So for example, if I just want to do guys and Tommies, I could check that box here and uncheck everything else. There is also a word search function where you can actually put in phrases here. When you reconfigure these, you will have that layout saved for you. So it's going to remember the configuration that you set. So for example, because you can move these widgets around, I've moved blood sciences to the middle of the page, that will keep that configuration and the filters as well. There's a option to reset filters to user defaults, or you can also look under the menu, and there is actually an option to reset view to system defaults. So that will pop blood sciences back where it originally was. For each of the widgets, they will move around as you reconfigure either the layout here under the bar where it says automatic and otherwise, or if your screen is too small. So if you're looking at this on a smaller screen, it will reconfigure the columns to match your screen size. So just bear that in mind. So for example, if I were to make this really small here, so I've reconfigured this as if it was like looking at a tablet, I'll only see one widget at a time. So it'll give me only 1 column. And then as I've made it go back to a bigger screen, it's gone back to 3 columns. So it does that automatically, but you can actually change it manually in the layout filter here. On each of the boxes, or what we like to call widgets, These can also be configured individually. So it may be that you wish to expand this just so you can see that one box as a full screen. Collapse it again. You can also hide the summary. So it's got a little arrow with a line at the top of it that hides that, or you can drop it back down again. So each of those boxes should have that option. Some of them also have filters as well. So for example, if it's a summary, it has a little drop down menu for filtering those results as it pulls through. And because the layout of your page may reconfigure depending on your screen size or where you've moved your widgets around, I'm going to give you widget names, but I'm not necessarily going to say the location of them because actually that will change as you move your screen or according to your user preferences. So other things that you can turn on and off is if you go to the menu on the right-hand side, in addition to being able to reset the viewed system defaults if you've messed around with the configuration and want it back to normal, you can also look up you can switch on and off the demographics bar, which is at the top. So that's now gone. Or I can turn that back on again. You can show the partner status. You can turn on and off the filters, and also the disclaimer here, which talks about the way that data is pulled through and how it should be used. The London Care Record, like any other clinical system, has an audit trail. So the things that you search, patients you access, different documents you access, will have a trail to say that you have accessed those, who's accessed them, what time, what date, just so that this is all auditable, and that it can show a trail of who's been accessing a particular patient's records and when. So let's start first of all with referrals. So say I want to know what referrals this patient has received recently or is on right now. And if this patient were part of Lewisham and Oxley's community services, they would have a referral here in the community referral widget. This particular patient doesn't have one. But say I want to check future appointments into secondary care. So if I scroll down, there's a future appointments widget here. And again, this patient doesn't have any future appointments set up for secondary care. But if the patient did, it would show appointments either through Lewisham and Greenwich Trust, King's College Hospital, Guy's and St Tommy's, and the Royal Brompton and Harefield. Alternatively, you can look at visits. So visits will have a summary that's pulled through of referrals into secondary care. That's the acute hospital visits. So for example, you can see referrals here into Queen Elizabeth, you've got colposcopy, you've got dermatology one with Lewisham and Greenwich. So that just gives you a nice summary, and then you can also click through to those to get more information. So one of the other places that you can look for referrals if you're really not finding what you need is in clinical documents. So this will have all letters that are sent out from secondary care to the patient, usually with the GP copied in. So you may find, for example, an invite to an appointment letter. So say we've got a clinic letter that will pop up, and perhaps they've got an invite to an appointment. The only thing I will say with clinical documents is it has all letters. So it may not be the quickest place to find referrals, but if you are struggling to find them in either the visits tab or the community referrals tab or the future appointments, then another place you can look is clinical documents. We're hoping that as the London Care Record matures, that we are going to start pulling more of these sorts of information into the summary boxes. So we can have more summary boxes like future appointments and visits that will have all this information in one place. But obviously at the moment we have different sources of information coming in different ways. So they are accommodated in different widgets. Okay, next, let's see if I can look at the procedures and investigations that this patient has had. This is for the procedures that might happen in an acute hospital setting. And we'll look first at the procedures widget. So here we go down here. So again, this one has a little summary that you can filter. And we can actually see it right off the bat. We can actually ask for more details here. Okay, so say I want to look somewhere else. Perhaps I want to look at what bloods have been done. So we've got separate widgets up here for blood sciences, cellular pathology, microbiology, and then we've also got radiology here. So each of these has a little summary box that you can then filter. So we've just got the summary here or details. And up here with blood sciences, there's a few more options to filter because obviously we're going to get a lot of results through here. So say we just want to have a look at general hematology. And okay, perhaps we're looking for platelets. So if you hover over, you should be able to see more information about the test that's been done. Then say, okay, that hasn't been helpful. Maybe we want to try something else. So let's say we want to check out this. So we've got chest X-ray here. So usually we would get like a full report here. So you'd see information about who's requested this, what's happened. The only thing to say with radiology is we won't get PACS images through the London Care Record. That is something that the team are hoping to do in future developments, but it won't be available for the London Care Record right now. Finally, for other investigations, or actually just a general comment on the London Care Record, these records won't go back more than 18 months. So just bear that in mind when you're looking at the date ranges. Let's say I want to look at medications. I want to find different places that medications are kept in the London Care Record. So one of the obvious ones here is the medications widget. This one actually just contains medications from the acute hospital setting. So if they were listed here, you would be able to see what medications may have been given in hospital, but it won't include things that are takeaway medications. So for example, prescribed in A&E and distributed by a pharmacy elsewhere. The other place that you can look for medications is actually under the GP's record. So you've got different options under the GP record for different things that you can look at and different ways of cutting up the data. So we just want medications, so we're going to click on that. And then you have 3 options here in the medications expanded box. So we've got the current medications this patient is on, past medications they may have been on, and then any issues that the patient has with certain medications. And then the final thing to say is if you're looking for medications that have been prescribed in the mental health setting, that requires a couple more steps. So you will need to go to clinical correspondence and look for the latest discharge from that mental health setting. So for example, here they've been discharged from SLAM. So I'd be looking for the latest date of a SLAM discharge. And within that discharge, you'll have information on what medications have been prescribed. Again, this is pulled through in a slightly different way, which is why medications are in slightly different places. The aim is to try and pull more of this information into summary boxes, but developments will be ongoing for the London Care